So today we're going to do something completely different. I'm not just going to give you educational tips like I normally do, which those are great too and they're helpful. But I'm going to take you inside the ER with me. So I've been a nurse for 32 years. My name is Paige. I've seen a lot of things that would shock you. I worked mostly in the emergency room, critical care. I flew with air ambulance. And so today I'm going to share 3 stories from my time in the emergency room. And these aren't just stories, they're lessons too. Lessons every single person needs to know to survive our healthcare system. So I'm not going to hold back. And it's not meant to scare you or anything. It's just to raise awareness of things that can happen. So, and as I tell these stories, if you have comments or you have questions, please put them into the comments, and I'll do my very best to acknowledge them, and we can talk about them. I definitely want to hear from you, so feel free to do that. And now I'm a patient advocate, so I worked a long time in critical care and in a few other areas in healthcare as well. And now I'm a patient advocate, so I help people navigate the healthcare system. And as we all know, there's a lot of ways people can fall through the cracks in the system. So my heart is to try and stop that and try and help people to get the care that they need. So as I tell these stories, I want you to listen for the lesson within them, because it's about pulling back the curtain on what really happens behind the scenes sometimes in the healthcare system. And I want to share that. I want you to share that. Like, if you get something from it, I want you to share it in the comments. So let's just kind of get started. So the first story, and I'm going to use names that aren't their real names because of privacy, obviously. The first story began, sorry, I have an itchy eye, on a Tuesday night. And these are stories that happened quite a long time ago, but I remember the days, I remember the names of the patients, and I remember them quite vividly. It was on a Tuesday night, and a young woman, Sarah, not her real name, came to the ER, and she was 28 years old. She was a runner. She looked the perfect picture of health. Like, she looked super healthy. She complained of a racing heart, shortness of breath, and a strange tingling in her hands. And she said she felt a sense of impending doom. And that's a big red flag there when people come into the emergency room and they say they have this feeling of, "Hi, Jessica. I'm telling a story." If you're just jumping on here now, my name is Paige. I'm a nurse. I've been a nurse for 32 years. And normally my lives are, I'm sharing educational information, but I'm bringing you into the world into the emergency room with me. And I'm telling some stories of people, real situations that happen. And the goal isn't to scare you. It's to kind of raise awareness, just kind of raise awareness of things that can happen in the healthcare system behind the scenes. Hi, Gorilla. Hi, KQ49. Hi, Sarah. If I say your names wrong, I apologize. So yeah, I'm just kind of starting to share some stories. So the first story, and these are all things that I experienced in the emergency room. So I just want to bring you into the emergency room with me. You're 14, you're in early labor. So yeah, oh my goodness. Wow. Well, that's exciting. Wow. Okay, so the first story, it begins on a Tuesday, and it's weird that I remember the days, but I do. And the patient's names, they're not their real names, but I'm going to call her Sarah. So she was a young woman. She came into the ER. She was 28 years old. She was a runner. She looked like perfect picture of health. And she came in and she was complaining of a racing heart, shortness of breath, and a strange tingling in her hands. And she said she felt a sense of impending doom. Which is a big red flag, which I already mentioned. The doctor on duty he was like young, sharp, but he was a bit overwhelmed. It was really busy that night, and he saw a healthy 28-year-old woman with classic anxiety symptoms. And so he kind of right away saw her as, well, it's anxiety, right? So he did an EKG like of her heart, and it came back normal. Her oxygen levels were fine. Came to the logical conclusion that she was having a panic attack. He was really kind and everything, but he was very dismissive. And he told her, "Sarah, your tests are normal. It looks like you're having some anxiety." And he wrote a prescription for a sedative and got her discharge papers ready. But I was the nurse assigned to her, and something just felt like wrong to me. It just felt, and it's this intuition you get, and it's a feeling you get after decades on the job, maybe, I'm not sure, but it was just a gut instinct. My intuition was saying something's not right here. And her skin had this like pale kind of grayish tint to it that you only see when a body's under stress. So, and she was breathing fast, but it was really shallow. Like it was too shallow and it just didn't seem quite right. Oh, thanks, Sarah. That's awesome. Thanks for subscribing to my channel. That's great. And like I said, this live is quite different from my videos, and it's quite different from the other lives that I've done. I normally do kind of an educational, and we do lots of talking back and forth. I'm going to do a TikTok live right after this, and that will be more interactive. But anyways, today I'm just telling these stories on here. But if you guys have comments or you have questions, please put them in the comments and I will definitely come back to them. I'll pause after each story. I've only got like 3 stories that I thought I would share that were kind of front in my mind. So anyways, her breathing. So here's this doctor. He's I wouldn't say gaslighting, but he was dismissive. He just assumed she was having anxiety because she was young and she looked fairly healthy, and was going to send her on her way. I felt off, like something just felt really off to me. And so I went up to the doctor and I just said, like, I'm not comfortable with you just sending her home. And I said, like, I know that the EKG is normal, but her color's off. She looks a little gray to me. Can we please run a D-dimer test just to be safe? Now, that's a really specific test that tests for blood clots. And so he was annoyed, like he was super annoyed with me. It was a busy night and he's like, you know what, Paige, her oxygen is fine. She's 28. It's a panic attack. And that was the moment. And like, when you're listening to these, like, listen for the lessons in this, but that was a moment that I had a choice. I could back down or I could stand up and advocate for her. So I chose to advocate. And I said, you know, I understand, but for my own peace of mind, I'm asking you to please order this test. And he like rolled his eyes and he slammed his book down and had like this big shenanigans, but he ordered it. And an hour later, the lab called with a critical result. Her D-dimer was like sky high and it was a massive red flag for a blood clot. So we rushed her to get a CAT scan of her chest, and there they were. There's multiple blood clots in both of her lungs. And so she wasn't having a panic attack. Her body was screaming for oxygen because her lungs were failing. Like if she had gone home with that prescription for anxiety, she would have gone to sleep and probably never woken up. And she was hours, maybe minutes from a fatal event. So the lesson in this is twofold. First, trust your gut. Like Sarah, she knew it wasn't just anxiety, and I knew something was off, and she just kept saying, like, I've had anxiety before, but this is different. So that's really important. If you know, like, you know your body best, and if you feel like something's just off, please speak up about it and just be persistent about it. And you don't have to be aggressive or anything like that. You can just be really persistent. Like, I understand, doctor, that you think it's this, but that just doesn't feel right. Can we see what else this could be? And then second, if you feel you're being dismissed by your doctor, you've got to ask the question, like, what else could this be? Can we please run one more test just to be safe? It's not being a difficult patient. It's being your own advocate, and like it can totally save your life. So anyway, that was a story that kind of came to my head. I'm just going to look here and make sure I don't miss anything. User, oh, that's hilarious. This is the woman I want for Christmas, Santa. Hope you're listening. Oh, that's awesome. Hi, Aiden. Okay, Jessica, I have epilepsy, and one time I did nearly have like a seizure, and my teacher wouldn't let me get your pills, and you had a seizure. Oh my goodness, I'm so sorry. That is hard, and they were in your locker. Oh, yeah, and then your doctor thought, or your teacher thought you were on drugs. Oh my goodness. Thanks for sharing that. That's scary, you know, when people don't believe you, and it happens a lot with younger women. Like it happens with lots of people for sure. And I don't want to just say women, because it happens with a lot of men too. But it definitely happens with younger people. It happens with older people as well. And doctors will kind of gaslight, or they'll come up with a bias about your age. Well, you're young, you can't be that sick, right? So yeah, I'm really sorry that you experienced that. That's tough for sure. Okay, so I'm gonna tell you another story. So these are stories from the emergency room. And so I'm just bringing you into the emergency room with me today. Jessica, and he was like, let's check and turn on flashing light. Oh my goodness. So we thought you were, so he wanted to test you to see if you were going to have a seizure, and by flashing the lights off and on. Oh my goodness. Oh my, that's, that's kind of crazy. Oh my goodness. Well, I hope that you're okay. Yeah, I hope that you were okay and that you eventually got your medications. Okay, so this is about, so my next story is about a man named David. That's not his real name. Oh, you were 11 when that happened. Oh my goodness. Oh my goodness. Okay, so David came into the ER on a Saturday afternoon. And I'll never forget this one either. He was 38 years old. He was a little bit overweight, but he was really stressed out from his job. And he told us he had a terrible burning pain, like right in the center of his chest and kind of his belly. And it started after lunch. He had a big lunch, and then he had this kind of belly pain, and it was, a little bit up from his belly. He was convinced it was the worst case of indigestion he'd ever had. Like, he was 100% convinced that's what it was, but his Tums and everything he was taking wasn't working. He looked a bit uncomfortable, but like his vital signs were mostly stable. That's like blood pressure, heart rate, temperature, respiratory rate. Those are your vital signs. The doctor did a quick exam, and it seemed to confirm David's theory. His belly was soft. It wasn't like hard or anything, which is a good sign. And so the doctor ordered, we call it a cocktail. And it's a mix of medications, and you drink it, and it's meant to kind of soothe the stomach if it's antacid if it's acid reflux or heartburn or something. Anyway, and he also did an EKG to rule out a heart attack, but which came out normal. So the plan was to let the medication work and then just send him home. That's what the doctor's plan was. But as I was talking to David, he said something that made it's a feeling I can't explain. Like, it totally made, well, you probably have experienced it in other settings, made the little hairs on the back of my neck stand up. Like, it was eerie. And he just said, it's the strangest thing. The pain feels like it's moving. And it started in my chest, and now I feel it in my back and between my shoulder blades, and it's in my belly. And pain, and I know just from years of nursing that pain that moves or migrates, it's a massive red flag. And indigestion doesn't do that. It stays in one place. Like heartburn doesn't do that, but an aortic dissection does. And so that was kind of my red flag. And an aortic dissection is when the main artery from your heart, the aorta, it tears. So it tears on the inside. And then blood kind of tunnels between the layers of the artery walls, and it kind of causes it to split open. I don't want to get into too many details, medical jargon, but that's sort of what it is. It's one of the most lethal emergencies in medicine. And it often presents as like a tearing or ripping pain that moves around, like it travels. So anyways, I went to the doctor right away, and he said, I said, like, the pain, David told me that the pain is migrating or moving to his back, and I'm worried about a dissection. And again, the doctor was skeptical. He's like, he's 38, he's not 78, he's got no history of high blood pressure, it's indigestion. And he was like rolling his eyes, and he's like, oh, Paige, and he was getting kind of, he was angry. He was like super frustrated with me. Anyways, so I pushed back. I just said, I know, but the migrating pain is classic. Can we please get a CT scan of his chest and his abdomen, like now? And something in my voice must have convinced him, and he ordered the scan like right away, ASAP. And the results were a nightmare. He had a massive type A aortic dissection starting right at his heart, and it went down right into his belly. And he was basically a ticking time bomb. We didn't even send him to a room. We called the cardiothoracic surgeon who met us in the ER, and he was rushed straight from the CT scanner up to the operating room, and he had like this massive life-saving open heart surgery, basically. And it was funny because the surgeon later told me, the surgeon, not the ER doctor, the surgeon said that if we would have waited another 30 minutes, the artery would have ruptured and he would have been gone. So the lesson here is that, like, the character, when you're talking about pain and you're explaining pain to a doctor, the character of your pain matters. Like, not the pain scale. And I've done lots of videos on the pain scale, right? And it's fairly ineffective. I mean, it's okay for kind of a guideline and to have a baseline with the same patient, but it's different for everybody because pain is subjective, right? Like, everybody experiences pain differently. So describing the pain really matters. So is it sharp? Is it dull? Is it burning? Does it move? do things make it worse? Like, don't downplay your symptoms when you're talking about pain. And if something feels strange or just different from anything you've ever experienced, like, describe it in as much detail as possible. And that gives the doctor a better chance of being able to help you. So, and especially if it's something that's moving, like it moved from here to here, really, really important things. So I just want to look on here, make sure I didn't miss any messages. Okay. Oh, hi, Jessica. You're still with me. Excellent. I'm glad that you're here. And if you're just joining on here, my name is Paige. I'm a nurse. I've worked in critical care mostly, so emergency rooms, trauma ICU. I've flown with air ambulance. I've worked a little bit in detox and addictions nursing, and now I'm a patient advocate. So I help people navigate the healthcare system. So that's kind of what I do now. And I mean, we all know of all the ways that people can fall through the cracks in the healthcare system. So that's what I try and help with. I help and go ahead and subscribe to my channel if you haven't already. And then you'll be able to see kind of what types of videos that I do. User BW8, great stories. Anyway, where should I look for the key to your heart? Oh my goodness, that's a big question. Okay, I want to just quickly mention my book. So this isn't a plug for my book, but I've been asked on videos to share it a little bit more frequently. So I wrote this book. It's Unlocking Healthcare. And it's a guidebook. So it's how to navigate the healthcare system. So I'm an author as well, which is why my channel says Paige Lennox Books and Patient Advocacy, because originally this channel was going to be about my books, and then it kind of morphed into more of my advocacy stuff. Well, now it's only my advocate work and my healthcare stuff. So anyway, this is the book. It's on Amazon. Great stocking stuffer. Well, actually, I don't know who would want to get a healthcare book in their stocking, but people are buying them for stocking stuffers, so you never know. And it's not a book you read from start to finish. It is a guidebook. So there's a table of contents, and you basically go to whatever chapter is applicable to you. And there's mental health, there is LGBTQ, there's indigenous health, remote health. There's a chapter for caregivers. There's one for end of life, mental health. Understanding your rights as a patient, understanding like test results and how to kind of navigate those, and insurance, all kinds of stuff in here. So anyway, and it's all color coded, and then you just find the chapter and it's got lots of resources in it, lots of places to put notes. Anyway, there it is, and that's the back. So that's that. Okay, so I'm just going to I've got another story. If you're up for hearing another story. So normally I do, and if you're just joining on here, normally my videos and my lives are more educational. I'm kind of teaching on different topics, or people are asking questions and then I answer them. I thought I'd try something a little different today and just share some stories and bring you into the ER with me. These are real stories that happened while I was working in the emergency department. So I've told a couple of stories already. I'm going to, and when you're listening to these, really, like, there's lessons in them for how to advocate for yourself or a loved one in the healthcare system. And it's not to freak people out. It's kind of a behind the scenes things that can happen, but it's not to scare anybody. It's just to raise awareness, right? And I do believe if you have more information and then you're going to be more aware of things that can happen and ways that people can fall through the cracks in healthcare. And then it's kind of in the back of your mind as you're going through whatever healthcare journey, then you can kind of be more aware and a bit more assertive and maybe communicate differently. So, anyway, so this last story is the last story I have. And please, if you have questions or you can relate to these, or you have an experience that you want to share, please put it in the comments and I will make sure that I get to them. After I'll read this story, I'll tell you this story first. I'm not reading them because if I was reading, I would be like, I wouldn't be able to read probably because I'd be too distracted. Anyways, and then I would miss all the stuff that is going on the screen, which is a little overwhelming. Okay, so this last story, it's a simple mistake, and it's a simple mistake, but it had an almost devastating outcome. It's about why you as a patient, hi baby Saja, welcome. The last is, yeah, it's about like why it's so important to be an active participant in your own care as a patient in the healthcare system, especially when you're in the hospital. I mean, even when you're, with the doctor or whatever, but it's like, especially when you're in the hospital. So there's a young woman, she was a patient of mine, and I'm going to call her Chloe. That's not her name, but that's the name that came to my head just now. And she was younger, and she was in the emergency room for a severe migraine that she couldn't get rid of at home. It had been going on for a while. She was in a lot of pain. She was very nauseous. The doctor ordered 2 medications for her. So one was a powerful painkiller and one was a strong anti-nausea medication, and both were given to her as pills. I was the nurse in charge that shift, and I was overseeing the whole emergency department. So about an hour after Chloe got her first dose of medication, her nurse came to me and said, Chloe's acting a little bit strange, like actually quite strange. And she said she's like really agitated, she's really confused. And it was just a red flag because she wasn't that way before. And then an hour later, after taking these pills, she just was acting very, very strange and very different. So those are red flags when you're working as a healthcare professional. And it just didn't make sense for a migraine to turn into something like that, where she just really agitated and then all of a sudden confused. So I went into the room, and Chloe, she was just not herself, and she was restless, and her eyes were kind of darting around. And I looked at her chart, everything seemed normal. Like, I looked at her vital signs, and vital signs are your blood pressure, your heart rate, your your breathing, and then your oxygen and your temperature. And everything was normal. Like, everything looked okay, which it often is with a migraine. Sometimes the blood pressure and heart rate can be a little bit high. But everything, like her heart rate might have been a little bit high, but nothing alarming. Then I looked at the medication wrappers in the little paper cup beside her bed, and my heart just stopped. So there was 2 empty wrappers. One was for the painkiller that she was supposed to get. The other was for a medication that I recognized instantly. It was a powerful antipsychotic medication, and it's sometimes used for severe agitation. It wasn't an anti-nausea medication at all, which was the other one that she was supposed to get. So in the pharmacy, somebody had made a terrible mistake. The 2 drugs were similar sounding, like the names were similar, and they were stored near each other, and they had sent up the wrong pill. So the nurse, who was busy, and and I've done this, like, I've made medication errors. Thankfully, it was nothing as serious as this, and thankfully nobody ever got hurt or was too badly affected by it. But every single nurse, if a nurse says she's never made a medication error, she's probably lying, because all of us have done it. It can happen, especially in the hospital when things get busy. But anyway, this particular nurse, she was just really busy, and she trusted the pharmacy. The pharmacy had come up, given the nurse the medication, and then she gave it to the patient without double checking, which is, I mean, that's not normally what happens. We usually triple check those things. But anyway, so we gave Chloe a medication. This happened, we gave her a medication to immediately, like, to reverse the effects of the wrong drug. She had gotten the antipsychotic, and she was groggy and confused for a few hours, but she made a full recovery and she was fine. It was a near miss, but like, a simple error could have had really serious consequences. So the lesson in this, it's not to be scared, but to be aware, right? So you need to know what's going into your body, whether you're, at the pharmacy collecting your medications, or you're at the doctor's office and they're giving you a sample, or you're in the hospital and you're being given pills or a medication in an IV or whatever. When a nurse comes in with a medication of any kind, it's not rude to ask, like, what are those medications and what is each one for? If you have your phone, look them up. Be an active partner in your care, because nurses and doctors are human, so are pharmacists, and the system isn't perfect and mistakes can happen. So your own vigilance is your final and most important line of defense, basically. So really super important to do that. So these stories are real. They happen every day in the hospital, everywhere, probably. I don't share them to scare you. I share them to prepare you. And the patients in these stories who had the best outcomes were the ones who spoke up, who shared information, who had advocates, like people fighting for them. And you have more power than you think. And I hope you're hearing these stories has opened your eyes a little bit, maybe empowered you to be like a fierce advocate for yourself and your loved ones. And as you can tell, I'm really, really super passionate about advocating for yourself and your loved ones. So yeah, anyway, thank you for listening. I don't know if anyone has any questions or comments. I probably won't stay on here for too long, but I just wanted to share those stories and see how those things land, how those stories land, and try something new. And anyway, thanks for listening, you guys. If this is valuable, please share this. It'll stay up on YouTube indefinitely or until I remove it. And I'll be back probably either Tuesday or Thursday evening. I'll be back doing another live. And so stay safe. Don't stop fighting for the care you deserve, you guys. You deserve it. So anyways, we'll talk to you soon. And I'm going to sign off now. Bye.